Good evening and welcome to our COVID-19 update. I am Ladi Akere-Doluale. Here are the highlights at this hour. Ogun State joins Lagos in keeping places of worship closed, churches and mosques to be affected. Hundreds of Nigerians previously stranded in the United Arab Emirates and 2 other countries arrive in Abuja, going to 14 days self-isolation. And World Health Organization says COVID-19 pandemic is entering a new and more dangerous phase. Ogun State Governor Dapo Abiodun has announced the suspension of the planned reopening of religious places of worship across the state. Governor Abiodun says this has become imperative in the face of the rise in the community transmission and spread of the virus in the state. He made the declaration while briefing journalists in Abeokuta, the state capital, just as he announced that the current ease of lockdown from Monday to Friday is still in force.
As a responsible administration, we chose life and the well-being of our citizens and are therefore constrained to take the painful but necessary decision to maintain the current regime of ease of lockdown in the meantime. We are consequently suspending our initially slated reopening of places of worship. Let me thank some of our religious leaders who, by themselves, advised that this is the best decision that we should take at this time in the best interest of all of us. This is not an easy decision, but we are confident that the wisdom and scientific basis for this decision will become clearer to those who may have initial misgivings about it. Since the advent of this pandemic in our state, our cautious, methodical, data-driven and scientifically supported approach has ensured not only comparably superior outcomes, we've also not had reasons to reverse our decisions because our decisions are usually well thought out.
Meanwhile, as the coronavirus continues to change our way of life with lessons and evolutions on new ways of doing things, some frontline workers in Ekiti State speak on the new lifestyle occasioned by the pandemic and how it defines the post-COVID era. Our correspondent, Babajide Agbeyo, brings us the details.
Not many would have imagined that a time will come or something will emerge that will change the conservative way of doing things. But COVID-19 has come to change the narrative. Some top government figures in Ekiti State share their experiences along this line and the new things to expect post-COVID-19.
There is no doubt that the narrative has changed in every facet of life. It has been proven that the church is not the physical church, that the church is in you and in your room. It has been proven that schools are not necessarily the physical structures, that you can engage in e-learning, virtual education. It has been proven that you don't need to go to offices any longer, you work from home. These are some of the things that will become very prominent at post-COVID-19.
Now, since we started, the lockdown and restriction of movement, a lot has still been achieved in spite of the fact that we have not met face-to-face. Right now, all EXCO meetings have been virtual. All members of the Executive Council and His Excellency the Governor, we still hold our weekly EXCO meetings, but we hold it via Zoom. And it's just been as effective as when we're meeting face-to-face. So a lot of things have been, achieved in terms of, economy of time and space.
Well, that's the new world and the dynamism coming up. It's just for people to shape in and move with the tides of time. Babajide Agbeyo for COVID-19 update.
300 stranded Nigerians in the United Arab Emirates have arrived at the Nnamdi Azikiwe International Airport in Abuja. The arrival of the evacuees was announced by the chairman of the Nigerians in Diaspora Commission, Mrs. Abike Dabiri Erewa. Mrs. Erewa also tweeted the arrival of another batch of 50 stranded Nigerians from Pakistan. According to the NITCOM chairman, all evacuees are to observe the compulsory 14 days self-isolation according to the new protocol by the Presidential Task Force on COVID-19. The latest arrivals follow an earlier announcement of the departure of an Air France flight from Paris to Lagos today, with 15 Nigerians on board from France, Germany, Belgium, Holland, and Estonia, who had registered for the evacuation with the Nigerian missions in these countries. As the domestic aviation sector in the country attempts to put its house in order for flight operations in the COVID-19 era, it appears stakeholders may still have some way to go to recovery. With no expected palliatives delivered, many of the actors within the sector believe loose ends must first be tied before flights can resume.
$700 million, that's how much the aviation industry in Nigeria has lost through the months of the lockdown occasioned by the COVID-19 pandemic. With the domestic travel sector gearing up to resume, the issue of vacant middle seats on flight is one airline operators are against. While the airport authority has put a few plans in place,
we have some things in place too that we are doing, just getting ready for operations. If you, on your way coming, you see that our counters, we've provided shields, we've done some social distancing marking, and a lot of operating procedures are ongoing. How are we going to do it? How are we going to attend to our passengers? When people are coming in, what are we expecting from them?
at its latest webinar meeting with stakeholders, the Nigerian Civil Aviation Authority said 20 aviation stakeholders have submitted their restart plans. 6 airlines have scaled the airworthiness bar, and the federal government is still promising that the industry will get a palliative to cushion the effect of the COVID-19 pandemic. Bukola Joe Uketumbi, Channels Television News.
Well, earlier on, I spoke with the chairman of Air Peace Airlines, Mr. Allen Onyema, on the issues of reopening of domestic flights in the country. I began by asking what he thinks of the decision of the federal government that says June 21st is no longer a feasible date for the reopening of the airports or the skies.
Well, every airline operator, I'm sure, is very, very ready to go take to the skies once more. I'm sure we are all ready. But there may have been some other reasons why the government feels otherwise. We are ready, and we feel for our staff. We feel for our bosses too. The economy of the airlines is really going down. It's not just Nigeria. It has nothing to do with how strong Nigerian airlines are or not. It has nothing to do with that at all. Even the strongest of airlines worldwide are all groaning under the negative impact of this COVID-19. So it has nothing to do with Nigerian airlines being weak or not getting it right. We are ever ready. If you ask us to fly tomorrow, we'll do it. If you ask us to fly this night, we're ready to. I could put about 7 planes into the skies tonight, and they will fly comfortably and safely and come down.
There are those who say that, well, the delay may have been occasioned by the fact that the federal government is planning to give the airlines and the general aviation industry a bailout, which some had been asking for all along, to the tune of about, if the reports are to be believed, 27 billion naira for things like payrolls, for demurrage of the aircraft that have been parked and other things like that, in order to help the airlines, basically to help the airlines.
Well, I don't share in that view. We all asked for palliatives, but I don't think the issue of palliative is the reason behind not starting. I think it has to do more with getting set to embrace the new normal. The airports need to be ready. The airports need to be 100% ready. the Civil Aviation Authority must make sure they are comfortable with the level of inspection of all the airlines and all the planes that have been grounded for some 3 months, not flying. So these may be the issues there.
How have you resolved the issues of viability? And when I say viability, I'm referring to the issues surrounding if you are going to do social distancing inside the aircraft, meaning reduction of capacity vis-a-vis airfares. Some of your colleagues have said that it's impossible, that it can't be done, and the airlines will not be viable if the regulatory authorities insist on that. What's your own position?
Well, not just my own position, it's the position of AON, that is the airlines in Nigeria. We are all against the implementation of the free middle seat regime. We are very, very much against it. It will kill the airlines. It will just kill the airlines. First of all, we take into consideration the purchasing power of the average Nigerian. The moment you decide to leave the middle seat empty, that means in a 130 or 140 seater capacity aircraft, you may be taking about maybe 80 passengers or 90 passengers. And those 80 passengers must be ready to pay for the empty seats.
Finally, if the issue of the bailout also comes true, because that, from the reports we have, is also being quickly worked out to be dispatched to the airlines, what would you advise that this bailout be used for?
First and foremost, to solve the issue of job retention. I cannot sit here and want money to be given to me either to buy more planes or maybe I go out there and float a new airline while Nigerians are suffering. No, that's not me and that's not the airlines. What I think, majority of my colleagues want is a situation where these innocent Nigerians who have been hit, the downtrodden who have been hit by this coronavirus are taken care of. That is number one, job retention. Job retention is the most important aspect of keeping every economy energized. If a lot of people are employed, taxes are gotten from them. If a lot of people are employed, the issue of insecurity is solved.
The chairman of Air Peace Airlines, Mr. Allen Onyema. Now, to take a further look that dissect the issues surrounding domestic aviation and its prospects under this COVID-19 era is joining me is an aviation consultant who is also the chief executive officer of Belgian Consults, Mr. Chris Aligbe. He joins us via Skype from the Isolo area of Lagos. Good evening, Mr. Aligbe, and thank you for your time.
Good evening, Larry. Thank you. How are you?
Fine, thank you. I trust you're keeping safe in this era. I wanted to begin by asking, were you surprised by the fact that, according to the federal government, the airlines were not ready to take off on Sunday, which is the 21st of June?
No. I wasn't surprised. I'm not surprised because we anticipated that they won't be able to start as at that date.
What seems to be the bottleneck? Because if you listen to Mr. Onyema, who just spoke before you, he says the airlines are ready to go and that maybe the issues are on the side of government. So I don't know what you make of that.
Yeah, well, I am not, I'm not too sure that that's the whole situation. What I think is that, look, to restart the industry, you have a complex set of protocols. And these protocols are developed not just here in Nigeria, but even at the international level. It's a set of protocols developed by IATA, Airport Council International, working together with ICAO. ICAO is the lead organization. So all that are working together to bring out these sets of protocols. They are complex, and here we are going to develop protocols because aviation is an international thing. Our protocols must at least fit into the global protocols And we also will be able to put some domestic peculiarities into it. And this has not happened before. So everybody is on a question of learning the process, learning how to walk the ropes. And I am not too sure. Maybe one airline and say, look, I'm ready. One or two airlines, but all the airlines are not ready. And the intention is not to start when all the airlines are there or most of the airlines are not ready. That's one. Because on Thursday, there was a major webinar where these things were discussed. And virtually all of us there agreed that it was not time to start. Both the airlines, because I think AP's made quite an extensive comment on it, saying that there is no need to rush this if we are not ready. And from the look of things, everything was not ready. The minister was there. He scored most of the areas that had to be addressed. I don't think any area achieved 100%, that kind of a thing. And what we said is that we shouldn't start if we are not fully ready. There's no reason starting and then we come back again. We shut down again in order to restart. So let us have everything properly done. I think NCAA is working extensively to make sure that if we put all the loose ends together, both from the airlines, from the handling companies, from the airports, and other service providers like NAMA, that's what they are thinking of. So it is basically not purely on the government side, but I do know that the government hasn't given the palliatives. The airlines need some resuscitation. They need some fund to kickstart, to restart their operations again. I don't think that fund is there yet. So if that is what is being said, yes, there's some truth about that, but that's not the only thing that is stopping them. Virtually all stakeholders in state operators and service providers, they are not 100% ready. So that's the situation. We are not ready. I wasn't surprised. I knew there's no way we were going to take off on the 21st. And
let me ask you, Mr. Aligbe, before, because of our time, let me ask you this. There are reports that there's now a figure to the bailout that you're referring to as palliatives that the federal government is preparing to provide 27 billion naira for the airlines to use to cover payroll taxes, for the regulatory authorities to use that money as well, for the continuation of operations, backlog of rents and fees and so on, a total package valued at that sum. But from what you said, it doesn't appear as if the operators have seen anything like that yet.
No, as at the last webinar we had on Thursday, that money had not been released. See, airlines have had that day, 6 airlines had appeared to have been ready operationally, but financially, only 2 airlines submitted their financial details. So the palliative or whatever, the fund that has been put out there will not go until airlines have submitted their financial records. And remember, it is not just only the airlines. It's for other service providers, including handling companies, catering companies. Everybody in the value chain will benefit from this palliative to the extent that their operations require, the size of the operation requires. That's what will be done. So it's not a question of a piecemeal thing that is going to happen. So that's what the industry is looking at. NCA is working, and the minister is sitting at the apex, looking at every sector, even the regulatory authority. Have you done all that you have to do? Have the passengers been sensitized? Do the passengers know how safe they are in terms of safety of aircraft, in terms of health, safety? All these things are there, and so it is not a question of one person is ready, and therefore it is government that is delaying. No, it's a total thing, and we should look at it from that perspective.
All right, then. Thank you very much, Mr. Aligbe, Chris Aligbe, Chief Executive of Belgian Aviation Consult. Thank you for your time. Mr. Aligbe joined us via Skype from the Solo area of Lagos. Again, thank you. It's been our pleasure having you with us.
Daddy, thank you.
We'll take our first a break, and when we come back, we'll bring you the very latest in the figures as released by the NCDC of where Nigeria stands with COVID-19. Please stay on with us. Welcome back to our COVID-19 update. Nigeria, over the last 24 hours, recorded its highest daily COVID-19 infections tally of 745, bringing the total number of confirmed cases to 18,480. So far, 6,307 patients have been discharged, and the death toll is put at 475. Regionally, the states with the highest cases in the 6 zones are Lagos in the southwest with 7,896, the FCT in the north central with 1,451, and Kano in the northwest with 1,170. Edo State displaces Rivers in the south-south with 729 cases. Borno tops the table in the northeast with 464 cases, while Ebonyi leads once more in the southeast with 234 cases. In Jigawa State, the government there says it will once again close weekly markets because of low compliance to COVID-19 measures. The State Commissioner for Health, Dr. Abba Zachary, says the state's task force on COVID-19 has agreed with the market union leaders that if the measures were violated, the markets would be closed in order to prevent further spread of the virus.
Laraban Tambari market, which is just about 10 kilometers away from Dutse, the state capital. I mean, the compliance on the use of face masks is very minimal. And we've spoken to the leadership of the market and told them the implications, as well as the likely punitive measures government will take. If this thing doesn't occur, next time we come, the market will be closed.
Okay, you may probably lock down the market once again.
Exactly.
What of other markets?
We are also visiting, monitoring those markets also. Any market that we visit and there are problems, they don't comply with the government directive, the markets will be closed. And remember also that yesterday we had meetings with the leadership of all the markets together with the chairman of the 27 local governments across the states. And we agreed that these measures, wearing of face masks, hygiene, will be observed in all the markets. And we all unanimously agreed that if these are not followed, the markets will be closed.
From Jigawa in the north to Oyo in the southwest, civil servants and schools are gearing up to open on Monday, but the compliance level to the COVID-19 guidelines in Oyo State is still described as being very low. Our correspondent, Bukola Oriowo, earlier in the day went round to feel the pulse of residents.
Oyo State has just recorded its highest daily incidence of COVID-19 ever since the pandemic started. We had 103 positive cases yesterday, and the week has been quite busy because for about 4 days now it's been from 68 to 30 to 56 and now 103. These figures are scary to a large extent, and we went around town to find out how much information the people have. How aware are they of these happenings, especially considering the fact that in almost all the places we go to, compliance to the use of face masks gets worse by the day. Yesterday, we saw, for instance, like 5 people out of 20 using. Today, it's even worse. We have like 2 people out of 20 using their face masks, and we engaged quite a number of them to ask why they are not doing this.
I still believe people think COVID-19 is not real. Perhaps it's real and it's out there. It's obvious, we can all say it.
There's a lot of skepticism on the reopening of schools and the secretariat, which is scheduled to begin from Monday. Workers are expected to resume come Monday. We do not know, however, whether the government will change its mind, but we stand put people's opinion to know how they feel about this.
Keeping the school closed for up till now is for the health and advantage of the citizenry.
I don't think students can practice social distancing in the class. So I think students should be given like at least a month before resuming.
The government has evidently more to do, especially in the area of sensitization for the public to know that this pandemic is real and a threat to life. For COVID-19 updates, Bukola Ariowo.
And it's not only Jigawa or Oyo State that is concerned about low levels of compliance. The government in Nasarawa State is also very worried. Expressing his view during a meeting with all concerned, Governor Abdullahi Sule explains that there is a need for all to adhere to the safety guidelines. Our correspondent, Halima Gayam, has that update.
The Nasarawa state government is worried about the non-compliance to safety protocols by residents. Hence, a stakeholders meeting presided over by Governor Abdullahi Sule to take a stance.
The essence of the meeting today is actually to review some of the decisions that we have taken in the past concerning especially the restrictions on this pandemic that has continued to affect us. If you remember from the last time that we had taken, our numbers of positive cases have gone up drastically.
The government at the end of the meeting resolved that the measures as they were, as issued by His Excellency the Governor in Proclamation number 99 last 2 weeks, that's on the 4th of June, will remain. And the task force committees established at all local government levels under the supervision of the local government chairman must continue to ensure strict compliance with the proclamation and any other directive of this in this respect.
Out of the 178 confirmed cases in the state, the health commissioner revealed that 27 are health workers from various health facilities across the state.
We do have 27 which are health workers, and which are also have tested positive, 6 from FMC Kafi, 4 in the Latter Specialist Hospital, 2 in Nasarawa Egon from General Hospital, 7 in Medical Center Maraba, 5 in the private health facility in Kafi and specific Living Spring Hospital at Kafi, 2 in private health facility in Lafayette M&D Hospital, and 1 newly graduated doctor who is also resident in Kabu. It also pleased the entire council to know that about 80% of these were taken from the community infection, not only from the health facility as well as services.
The stakeholders were caught in between two decisions, whether to apply more awareness or more enforcement, but it later settled for more awareness. Halima Gayam for COVID-19 update.
Thank you, Halima. Let's look at safety measures that need to be put in place before and after aviation activities resume, as well as the issue of general non-compliance. Joining me in the studio is a public health physician, Dr. Jamiu Ganyu. Dr. Ganyu, thank you for your time. Thank you for coming in.
Thank you.
Let's start with the aviation.
Yes.
From everything everyone has said, it's a highly specialized sector and therefore it's not in the same way that general. But were you surprised that they couldn't make up, or they didn't make up with the timelines that they were given, 3 weeks?
Well, I wouldn't be surprised because the issue of meeting conditions varies because we are talking about stakeholders. So it could be that some were able to meet up and some were not able. And it depends on the government, on the other side of the government too, right? What they were able to put, what the government was also able to put into in meeting the conditions. And apart from that, I want to think maybe government is also trying to play safe with the rising cases of COVID-19 cases. So maybe it's a kind of, we can't be very sure. It could be from one angle that the conditions are not being met, and it could be that the government is just trying to play safe. Because when you look at the issue of aviation, there are 3 considerations. In aviation, you look at the issue of safety and the aspect of security is very important, and which also go with efficiency.
Right.
They also look at the public health angle, because when the aspect of public health angle is very key. In peradventure, maybe you start having cases where the ban is lifted, it will also reduce people public confidence. So I think we have to look at the public health angle. Then the last aspect of it is the economic aspect, because aviation will be looked at as a driver of economy. But left aside, I think according to International Civil Aviation Organization, they have a protocol, and that protocol look at those 3 criteria. They now develop some stages. We call it risk-based mitigating measures.
Okay.
And these measures is in stages from 0 to 4. Currently, we are in stage 0. And what does that mean? Restriction of movement, allowing just essential, travels, evacuating Nigerians from other countries. So we are in stage 0. What we are trying to move in is stage 1. And what does that stage 1 means? Mean that allowing just small volume of passengers, but with conditions. We must be able to institute some mitigation measures. I will mention them. And then after we're able to certify that, then we move to stage 2. That's where we allow large volume. Then stage 3, that is where we allow the more number of
flights to move, yes,
both domestic and internationally, with the condition that we continue to with our contact tracing surveillance, even where there is no vaccine or drug for treatment.
Right.
Then the last stage has to deal with when we now have drug and we now have vaccine, so that we normalcy returns, but with some level of mitigation measures. But without, it's in stages, not that there is total suspension of the aviation movement or operations. It's just that it's in stages. We're just appealing, they're about just moving to stage 1. Where stage 0.
So what are the things we needed to do to move from stage 0 to stage 1?
Good. You see, according to guideline, we have general guideline that look at the passenger and the airline operation. Then we now have the specific that look at specific area of the airline operation. Like for the general issue of health education, people that for the passenger, you need to educate them. The message now will be tailored towards COVID-19. Let them know what we are into, their experience, what they are likely going to be experienced. The issue of physical distancing in the air flight is very important. So in case they cannot be, just like overheard somebody saying that we cannot, is not practicable, what are the alternate risk-based measures? The issue of face masks is also very key. How to wear it, how to remove it, and so on also are very key. And in a situation whereby a passenger cannot, there are some passengers that wearing of face mask is a challenge. What are alternative risk-based measures? Then we have to talk about the issue of routine sanitation. You know, there will be an issue of touching or not the aircraft and so on. The issue of health declaration, as it's been done currently as we're evacuating Nigeria here, where some people need to declare where their status and so on. Issue of testing. You have to test. Are we going to implement it at the domestic level? So that before anybody, come on board, must we know the COVID status of that person? All those things are issues that has to do with the general guideline that need to be put in place. Then we now have the specific. This specific we look at in the airport. We look at the entire airport, the body, different aspect, the departure and the arrival, or the checking point and so on. What are we able to put issue of social distancing, the contamination at airport and so on? All those things are also very, very key. It will not be like the usual way anymore. In the sense, how many number of people will go and pick their luggage? How many number of people are going to wait? The issue of physical distancing is very important. We also look at the crew too, because they are also susceptible. Yes. In terms of testing, quarantine, and so on, it's also very critical. We also look at the issue of cargo. As per how are we going to restructure? All those things play critical. That's why you can see. I saw how the boarding areas, how they are trying to shield people. Initially, it wasn't like that, but everybody is taking every. So there are a lot of public health measures that we need to put in place. Not just operate. I overheard I don't want to mention the best talking about we are ready. It's not about ready. We have to make sure we institute every mitigation measures to ensure that we are not encouraging transmission of COVID-19 in the aircraft. So thank you.
All right, thank you so very much, Dr. Jabil Ganiu, for joining us tonight. Food for thought for those who are in the aviation subsector, quite a lot for them to think about. It's been a pleasure having you with us in the
Thank
studio.
you
Thank you
very
so
much.
much
Thank you.
for your time.
Okay.
The South African economy at least 6 years to recover from COVID-19. According to a new estimate, President Cyril Ramaphosa said that he was trying to balance, quote, our overriding objectives of saving lives as well as protecting livelihoods, unquote. Around 40% of South Africans live below the poverty line, and the lockdown has hit them hard. I'm now being joined by our South Africa Bureau Chief, Betty Dibia. Good evening, Betty. First of all, let me start with the theme that we've been following all through the program, and that is the reopening of domestic aviation. In South Africa, domestic aviation has reopened.
Yes, that's true. It started with the level 3 lockdown, and the flights, mostly budget airlines, began on Monday. So the minister spent a lot of days going through the airports to see the level of preparedness, all the issues of health, safety, hygiene, sanitizing, the security as well, and the different changes that they're bringing about. Like now you have that the wrapping of checked-in luggage is now compulsory, crowding of carousels is no longer allowed, checking in or boarding is now going to be staggered. It used to be done, but it's now deliberately staggered so that you'll avoid the crowding at the boarding points. So nothing major negative has happened, so it's still going smoothly. And now the opening of hotels, because the travelers are just for business and work. No holiday travel is allowed at this point, but it's going smoothly for now. We haven't heard anything major that is grabbing the headlines. It's just the economic impact on the nation. The aviation, every sector indeed has lost a lot of money. So they're trying to get that back, and they can only, as they say, get that back if they get that back to international flights as well.
Well, it's important that you talked about the economy and how everybody's been hit hard, and that's where I'm going to hang this with you. In terms of the economy, has it improved now that flights are reopening? Quite a number of institutions have been allowed to reopen under the level 3 situation, and possibly will be going to level 2 in the very near future.
I wouldn't say it's improved, but there's more hope that more people will be able to put food on the table just at that level. But recovery, if you look at the figures that the different bodies have given, is going to take some time. But the president has insisted that, this is a chance for the country to look at ways they've been doing things, including the policies, including their processes, including the institutions, to see how prepared they are to handle things like this and the devastation that this pandemic is going to bring to the economy that was already ailing in the first place. So we know that the stats essay, that statistics essay, will be releasing the quarterly labor survey by Tuesday next week. Nobody is expecting something good out of that. And but the president will be hosting what he called the infrastructure symposium to look at investing in the infrastructure in the country to drive growth, and also to look at a post-COVID recovery plan. So it's still work in progress. It's going to take some time, like every other country that's been affected. But there is renewed hope when more and more industries or industrial sectors will be allowed to get back to business.
All right, then. Thank you so very much, Betty, for that update, and do continue to stay safe out there.
Thank you very much.
The World Health Organization has warned that the COVID-19 pandemic is entering, quote, a new and dangerous phase. Its Director General, Dr. Tedros Adhanom Ghebreyesus, says the world had seen 150 new cases, with half of those coming from the Americas and large numbers also from the Middle East and South Asia. According to him, the virus is still spreading fast and the pandemic accelerating, calling for more extreme vigilance from countries who are eager to open their economies.
In the United States, U.S. government expert Dr. Anthony Fauci says that he doesn't believe the country would need to return to widespread lockdowns to keep COVID-19 under control. despite the country's steady high number of infections and deaths. The United States is leading the globe with 2,191,200 cases and a death toll of 118,435.
Deputy Speaker, and with your permission, I would like to...
Meanwhile, the UK's chief medical officer has announced that the coronavirus alert has been lowered from level 4 to 3. Under level 3, the virus is considered in general circulation, but a gradual relaxation of restrictions can take place. The alert level is determined by the virus's reproduction and the number of confirmed cases at one time. Poland is one of the first countries to allow football fans back into stadium today as matches resume. The stadia are permitted to 25% capacity, and every fourth seat can be occupied by a fan, except for those living in the same household. Poland has recorded fewer coronavirus cases than many European countries, with 31,316 recorded infections and 1,334 deaths. In the Southeast Asian country of Myanmar, crowded bus rides are being switched to private port seating as a result of the coronavirus. Long-distance travelers will now sit with minimal infection risk behind aluminium doors as a social distancing measure. Myanmar has managed to contain its outbreak, with the country's total cases at 286. The country remains under public gathering restrictions in pagodas, mosques and churches until June 30.
Take responsibility by adhering to recommended measures coming from the health authorities. That's the message from the Nigeria Center for Disease Control, the NCDC. Its website has more information on the COVID-19 and national response. The World Health Organization has the latest and updates on the global response to the pandemic. The WHO website guides the public health response at national and subnational levels, including practical guidance for strategic action. Our website, channelstv.com, has more updates. You can find the latest on the COVID-19 pandemic in Nigeria and across the world, plus other stories. That's our COVID-19 update tonight. Thanks for being with us. I am Ladi Akiri Doluale. Do have a pleasant and, more importantly, safe weekend ahead. Good night.